Welcome to the Path Walk Mnemonics and Testing series. Today we are tackling cellular adaptations with easy-to-remember mnemonics that will help you lock in those concepts. And stick around till the end for some USMLE Step 1 style practice questions to put your knowledge to the test. Let's jump right in. When cells face stress, they adapt by changing their size, number, or even type to survive. We are going to go through the 5 main types of cellular adaptations. Here's a mnemonic to help you remember these. Heavy hats make dark accessories. Let's break that down. H is for hypertrophy. Cells get bigger like in cardiac hypertrophy, where the heart muscle cells increase in size to handle more work. A simple way to remember this is huge cells, heart enlarges. H is also for hyperplasia. Here, cells increase in number. Think of benign prostatic hyperplasia, where there are more prostate cells than usual. To remember this, just think plasia means plenty. M is for metaplasia. This is when one cell type is replaced by another, like in Barrett's esophagus, where normal cells change to deal with stomach acid. Here's your mnemonic. Metaplasia makes a change. D is for dysplasia. This is disorganized cell growth, often a warning sign for cancer. Think of dysplasia as disorganized. A is for atrophy. Cells decrease in size or number, like when muscles shrink due to disuse. An easy way to remember is a tiny organ. Cells are adapting to either physiological changes, like a pregnant uterus, or pathological changes, like an enlarged heart due to high blood pressure. Okay, now that we've covered the mnemonics, let's dive into some practice questions to test your knowledge. So let's see how well you've got this down. A 55-year-old presents with shortness of breath and a 10-year-old history of untreated hypertension. A chest X-ray reveals an enlarged heart, and a biopsy shows large heart muscle cells. What is the best explanation for this cellular adaptation? The correct answer is B. Increased size of cells due to increased synthesis of structural proteins. This patient has cardiac hypertrophy, where the heart cells enlarge to deal with the increased stress from hypertension. This is a classic sign of hypertrophy, where cells get bigger, not more numerous. Here is an illustration of how a hypertrophic cardiac muscle looks under a microscope. A 62-year-old man complains of difficulty urinating, frequent nighttime urination, and a weak stream. His prostate is enlarged but smooth on examination. Which cellular adaptation is occurring here? The correct answer is B. Increased number of cells due to hormonal stimulation. This patient has benign prostatic hyperplasia, where there is an increase in the number of prostate cells, causing the prostate to enlarge. It's driven by hormonal signals, like typically androgens. A 76-year-old bedridden patient presents with muscle weakness. His legs show muscle wasting, and a biopsy shows smaller muscle fibers. What is the most likely cause? The correct answer is decreased synthesis of structural proteins and increased protein degradation. This is a classic case of atrophy, where lack of use, in this case bed rest, leads to smaller cells due to reduced protein synthesis and increased breakdown of proteins. Next question. A 45-year-old man with 20-year history of smoking presents with a persistent cough. A biopsy of his airway reveals that the normal cells have been replaced by a different type of cells. What cellular adaptation is most likely there? The correct answer is B. Change from one undifferentiated cell type to another due to chronic irritation. This is metaplasia, where the normal ciliated cells in the airway are replaced by squamous cells as a defense against a chronic irritation caused by smoking. A 35-year-old woman with a history of human papillomavirus infection has a pap smear showing disordered growth of her cervical cells, with changes in their size and shape. What is this condition? The correct answer is D. Dysplasia. The pap smear shows dysplasia, which is disordered cell growth. This is often a precancerous change, especially in the context of persistent human papillomavirus infection. Great job, everyone. I hope these mnemonics and practice questions help you feel more confident in your understanding of cellular adaptations. If you found this helpful, don't forget to like, subscribe, and hit the notification bell for more simplified medical content. Keep studying smart, and I'll see you next time.